Watching your local news leader. This is WCIA 3 News at 6:30.
Our office can't even get a word out of CMS at all when we call, other than to say that they're not going to tell us anything.
A lawmaker says the state isn't listening to its retired workers who fear for the future of their health benefits. Dozens have been calling us for months after losing access to their trusted doctor.
That happened when state-run plan Aetna Medicare stopped covering Carl's Urbana Hospital and a number of other clinics. For months, the state has been in the process of picking a new set of plans. But ever since we found out even more territory was awarded to Aetna, the state has gone silent on requests for comment and interviews. Investigative reporter Renee Cooper is live in our Capitol newsroom tonight. So Renee, that decision is being appealed. Meanwhile, they're not answering yours or retirees' questions.
That's right, Jessica. They haven't answered our questions for almost a month now. My report yesterday raised questions of whether these state retirees would be able to see their Carl doctors if the state officially switches their PPO plan from United Healthcare to Aetna. Now, Aetna representatives did respond today and clarified some things from yesterday. They said although Carl's Eastern Central Illinois doctors and hospitals are out of network, Aetna says Carl advised they can see retirees on the new PPO plan. Aetna also says they'll pay for covered services at 100% of the Medicare allowable rate. That means the maximum amount a plan will pay for specific health care services. However, Carl has not clarified whether these out-of-network patients will be charged more for those services. A representative says Carl's going to evaluate patient impact once the state formally announces the contract. Now, today I dug through Aetna's HMO plan, or their application for the HMO plan. Thousands are already enrolled in that one, and those Carl facilities and doctors would cost that full price on the lesser expensive plan for state retirees.
We've been fielding these calls. We've got a bunch of angry people who are calling us, almost on a daily basis now, thanks frankly to your reporting.
State retirees on Aetna's Medicare HMO plan found their doctor options depleted early this year when Carl facilities in Champaign and surrounding counties fell out of network with their insurer.
We have to take what the state offers us.
Despite the loss of Carl in an area highly concentrated with state retirees, Aetna applied again this year to be an HMO provider and listed out-of-network provider Carl Foundation Hospital as in-network in its submission to the state. What responsibility does the state have to have caught that?
Look, this is part and parcel of the Pritzker Central Management Services. They haven't vetted any of this for almost a year now, right?
Aetna does clarify in a questionnaire that Carl is out-of-network and that they did not apply to provide services in Champaign County this time around, but they did in Cumberland County, where patients like Mike Rodabaugh counted on a Carl doctor for years.
Literally, life or death decisions.
I learned today that no HMO plans have been awarded at this point to any of the 4 companies that applied. But we do know the Illinois Department of Central Management Services, or CMS, gave Aetna the highest score for its doctor network. But why submit a misleading directory? And it all raises questions about whether the state agency is verifying these doctor lists or just taking the company's word for them.
And I'll tell you what's even more fascinating is when I called them and said, like after your early stories called, I called them and said, guys, this network doesn't exist. They're like, oh yeah, it does. What do you mean? Oh no, it's there. There's no problems. We don't know what you're talking about. And then I called Aetna. I was like, no, it's not there. And so even Aetna agreed it wasn't there. But I think the appropriate place here would be for the state government committees of the House and the Senate to fire up some hearings to try to figure out what is actually going on, and frankly to put some light, put some sunshine onto this issue.
Now remember, no contracts are official for these state-sponsored plans that are expected to go into effect on January 1. Now, open enrollment starts for these state retirees on October 1st. Live in Springfield, Renee Cooper, WCIA 3, your local news leader.